Hello, everybody. In the next 70 minutes, we are about to make some connections between eye health and climate action. Now, you're here because you care about both. You care about eye health, you care about climate action. We're going to make it very explicit, the connection between the two and what we need to do about this. Hello, I'm Femi OK. I am your moderator for the next 70 minutes. Thank you so much for spending part of your day with me and with some very special speakers as well. This event is going to be recorded. It is being recorded. You'll be able to see it and hear it later on YouTube and also on the IAPB website. As you can see, or maybe as you can tell, we have international sign interpretation. Thank you to our interpreters for being here. On your dashboard for Zoom, have a look at the very bottom of the Zoom dashboard. You will see live transcript. It has a double C there for closed captioning. Click on that and you can choose how big or how small you want the captioning to be. Our expert speakers will be joined by you because we have as many experts in the audience and curious participants as we do who are going to be presenting, speaking, and being part of the panel. Whenever you have a comment or a question, use the Q&A box. I would love to have you in this conversation. Our hashtag is hashtag UNFOV. If you want to take this conversation wider than just this webinar, you are very welcome to do so. And if we have any UN ambassadors in our Zoom room, our Zoom webinar, welcome ambassadors. If you would like to make a virtual statement from the floor, you can do that. But jump into chat, please tell us your full name, your title, the country you are representing, then we will take you backstage and get you ready for your virtual on floor statement. Thank you very much for doing that. Now, this is all assuming everything is going smoothly. If you have problems with this webinar, well, don't worry about that. We've got you. You can email us at iapbevents@myt.uk.com. Let me give that to you again. iapbevents@myt.uk.com. And remember when I said that this whole webinar was being recorded. So if the worst comes to the worst, if we can't fix it with our special IAPB customer service, then it is recorded on YouTube and on the IAPB website. So we are now all set with the business before we get to the official welcome. This webinar is brought to you by the UN Friends of Vision Group with the support of the IAPB. All three co-chairs will be joining. So I'm delighted to be able to say, first of all, hello, welcome, Ambassador Walton Webson, the permanent representative of Antigua and Barbuda to the United Nations and founding co-chair of the UN Friends of Vision Group. Ambassador Webson, over to you.
Thank you very much, Phoebe, and thank you for your continued support to the efforts and work of the Friends of Vision. So thank you. Colleagues, good morning from New York to everyone, and thank you again for joining us. We are once again extremely happy that you can join us for this important Friends of Vision event. Excellencies, colleagues, when my fellow chairs, co-chairs, and I founded this group a few years ago, the rationale for us was to create an opportunity to demonstrate to the governments and to the United Nations bodies that the critical role of eye health can play in achieving the SDGs. If eye health is critical to the SDG progress, then it's critical to climate action as well. As some of you know, I am the current chair of the Alliance of Small Island States, known as AOSIS, And as such, I was intimately involved in the recent climate change discussions in Glasgow, Scotland, in all of these negotiations. If the negotiations made one thing clear for all of us, it is that the world is still far off track from the stated goal of keeping global temperature rise to no more than 1.5 degrees Celsius. I might just add that 1.5, which is the mantra we have used to stay alive, is not a panacea. It's not where we would like it to be. We would like it to be below. Based on current pledges made, even at the last meeting, we are really on track to see warming of, some say up to 2.5 and some say higher degrees. That would be catastrophic for small island states like my own and low-lying coastal states that are members of the alliance. And it is catastrophic for the vulnerable populations of these states. 2.5 degrees warming would also have significant negative impacts on the way of life of the economies of even the richer countries. So we are truly in a global fight for our collective survival. The climate talks did include important agreements that the world governments will have to reconvene next year in Egypt to continue and increase our collective ambition and make commitments which can keep warming to below this 1.5 degrees that we seek. And friends, critically, governments agreed that funding for those already being impacted by climate change, many of whom are the poorest and most vulnerable countries of the world, must be provided by the developed countries, and we must do so urgently. Today, my friends, you will learn more about the impact of climate change on eye health and the eye health sector's contribution to a warming of the planet. I think it's important that we understand these linkages. So I am very pleased that you are here for us to have an open discussion on this. If we are to have any hope of preventing catastrophic warming, we must all do our part. Governments, the private sector, civil society, all right across all sectors. Virtually everyone agrees that climate change poses substantial risks to global public health, including eye health. Today, my friends, you will hear about about how climate change will likely increase the incidence of trachoma infections, vitamin A deficiency, a subject that I feel close to, severe allergies and diseases, glaucoma, and age-related macular degeneration. For these are just some, of course, including injuries that we will continue to face. But we can't only focus on the impact of climate change on individuals. We must simultaneously contribute to solutions. We can't find just problems, we have to find answers. Globally, healthcare is responsible for 2 billion tons of carbon dioxide. This is equivalent to 4.4% of all global net greenhouse emissions. That is significant. We must be more efficient and sustainable. For example, studies have shown that the same cataract surgery can yield 30 times more emissions in one country rather than over another country. 30 times. We hope you will come away from this gathering here today, from this event, with a better understanding of the ways in that eye health is in both impacted by and can contribute to climate change. It is important, my friends, that we take the knowledge and collaboration from today's meeting and turn it into action. Let's commit today to join together to advocate for a more sustainable healthcare system in all of our countries. Let us encourage the eye health sector to come together and establish assessment and reporting frameworks and mechanisms in order to track progress on these emission reduction. I would like to see in the next global meeting on climate that the health sector speak about its contribution to lessening emission. We all could and must do more. I thank you, my friends, for continuing to be interested in the issues and the work of the Friends of Vision. I look forward to hearing and being involved and engaged in this discussion. And I will now turn the program back over to Phoebe. And thank you again, Phoebe, for your stellar contribution. Thank you.
Ambassador Webson will return to be part of our panel discussion later on in our program. I am such a fan of the UN Friends of Vision group because they all co-chairs, all turn up all of the time. They're like the three musketeers, one for all for one. Let us go to another of the co-chairs so that she can also welcome you to this very important conversation about climate action and eye health. Ambassador Rabab Fatima is the ambassador and the permanent representative of Bangladesh to the United Nations, and as I mentioned, the co-chair of the Friends of Vision group. Ambassador Fatima, nice to see you. Welcome.
Thank you. Thank you very much, Femi, and it's always good to see you. And thank you for being with us on this vision, our vision journey. Thank you very much. Dear co-chairs, my friends, Ambassador Webson, Ambassador Nason, Excellencies, distinguished panelists, dear friends and colleagues, good morning. And I'm delighted to join my co-chairs in welcoming you to today's meeting of the Friends of Vision. We can end this year on a high note. This year, we finally got through the long-aspired first ever resolution, Vision for Everyone, unanimously adopted by the UN General Assembly on the 23rd of July. That was a very special day for all of us working in the vision area. We got that through our collective efforts and determination, despite the limitations placed by the COVID situation. And I would like to pay special thanks to Ambassador Webson for his leadership and support in this regard. And I would also like to thank our civil society partners who are the force behind us in taking this forward. Last month, I was at an event in DC organized by one of our civil society partners in this endeavor. And I saw firsthand what the resolution meant for the vision community and its potentials to bring about a difference on the ground in efforts to mobilize resources, policy changes, and programs. For me, it was a very gratifying experience to see the real impact of the work that we do here, what it means on the ground. This year, otherwise, was also a very challenging year as we went about recovering from the worst pandemic in human history. The twin crises of COVID-19 pandemic and worsening climatic conditions globally are having devastating impacts, especially on the most vulnerable communities and people and the low-income countries. And the double onslaught of the pandemic and climate change is threatening to undo decades of progress made in global health. Dear friends, we are meeting here today, as Ambassador Webson said, to know about the impact of climate change on our health. There's certainly a great need to have better understanding of the real context and connections. Climate change, we know, is just not an environmental issue. It is also a health issue. And public health experts say that there is also a link between climate change and deterioration of eye health conditions. As Ambassador Webson already mentioned, climate change is likely to increase the incidence of trachoma infections, cataracts due to overexposure with ultraviolet rays, or severe allergic eye diseases due to air pollution, and other disaster-related eye injuries. And climate change can also increase the potential of various infections and vector-borne eye diseases. And we look forward to hearing more about that from the experts who are on the panel. So the impact that this can have at various levels. At the global level, we heard again Ambassador Webson giving a vivid account of the devastating impact of climate change and shared his insights also from Glasgow. Climate change, as we know, disproportionately impacts the low and middle income countries who are bearing the largest burden. 90% of people with vision impairment are living in these countries who have limited or no access to vision care. And the marginalized population, including women and girls in these countries, are particularly vulnerable to adverse impacts of climate change, and as a result, on their health and eye health also. At the community level, environmental degradation, air pollution, and climate change are having a disproportionately severe impact on the vulnerable and low-income communities within a country. And the most vulnerable among them are the women, the aged, the children. They're the most impacted. And climate change and disasters exacerbate also pre-existing inequalities and vulnerabilities. It has been found that disasters induce eye injuries mostly affect women and the older sections of the community. Again, I'm not an expert on this. The experts are on the panel and we'll be listening to them. Dear friends, so what can we do to counter these climate change related eye health issues? And let me very quickly run over a few issues before we turn to the experts. Firstly, I fully share that our advocacy work needs to continue. We need to continue to raise awareness and understanding to the fact that climate change can have serious impact on eye health and well-being. Secondly, sustainable and inclusive healthcare services should be implemented in high-risk environments and communities that address eye health problems. We must ensure eye health specialists are included in disaster-related and emergency response to address eye injuries. Thirdly, all stakeholders should adopt gender-responsive approaches in adaptation and capacity building efforts, as we know that women are more impacted by disasters and climate change, and more women suffer from vision impairment than men. Fourthly, environmental sustainability within all eye care services can be incorporated to produce co-benefits by reducing carbon footprint and increasing quality of services. Finally, I believe our development partners, the developed countries, can come forward to fulfill their commitment for climate funding and facilitate technology transfer. It is very important that targeted funding for eye care is also made available as part of universal healthcare. Dear friends, dear colleagues, let me end here by saying that we need to now move towards finding solutions to the problems that are clearly there. The UN resolution, again, I turn to the UN resolution, a GA resolution has a lot of impact, has a lot of potentials to make an impact. And we believe that the UN resolution has created an opportunity for our governments to show leadership and accelerate efforts in collaboration with other stakeholders to fulfill the global commitment to leave no one behind. From our part at the Friends of Vision group here, the co-chairs and all of us will continue to do our part to raise awareness, build consensus, and encourage and take actions to mitigate the situation. We look forward to continuing our good partnership and collaboration with all of you. I'll rest it there, Femi. Thank you all. Thank you.
Ambassador Fatima. So, The final co-chair to join us in our webinar today is Ambassador Geraldine Byrne Larson. She is a permanent representative of Ireland to the United Nations and, of course, co-chair of the UN Friends of Vision Group. Due to her commitments on the Security Council, the ambassador joins us via video.
Ireland is really proud to be a co-chair of the group of Friends of Vision, along with Antigua Barbuda and Bangladesh. Indeed, this year, we're very encouraged by the broad support of UN member states in supporting the Vision for Everyone resolution, which was adopted in the UN General Assembly with the co-sponsorship of 115 member states. This resolution highlighted that eye health is not only an important discussion in the field of health, but is also highly relevant to achieving gender equality, quality education, zero hunger, and economic growth. If we're truly committed to addressing the root causes of poverty and inequality, and to progressing all of the Sustainable Development Goals, we simply must scale up eye care globally. This is not only important for the achievement of SDG 4, that is good health, but is crucial to other SDGs like gender equality and indeed to climate action. Earlier this month at COP26, we collectively recognized the impact of climate change in causing widespread interruption to essential health services for the poorest and the most vulnerable. Put simply, climate change is contributing to deepening global inequalities. Climate change is linked to increases in ultraviolet radiation, to air pollution and dry conditions on the planet's surface, all of which exacerbate eye health conditions. We know that climate change has a disproportionate impact on people living with a vision impairment in low and middle income countries, many of whom have a vision impairment that could have been prevented or is yet to be addressed. This is especially true for women, for older people with disabilities, ethnic minorities, and indigenous populations. I will conclude on this point and hand over the floor now to the experts from the WHO who have kindly given their time today to speak to this topic in more detail. I will close, as I often do, with a simple message at the core of this group, that good eye health can unlock human potential. Thank you.
Thank you, Ambassador. It is good to have you part of this program, even if it is on video or not in person. I know you're with us. So, coming up in our webinar today, we will have a panel discussion. We will have a Q&A. That Q&A doesn't work unless you put some questions in the Q&A box. It is open. It is ready for the first bold question. Your comments as well, very welcome. I will wrap them into today's discussion. We also have two presentations, really making that connection between eye health, development, and climate action. It will be very explicit by the time we wrap up this webinar. But we start, as Ambassador Byrne Larson actually suggested, with some expertise from the WHO, really setting the scene. What do we need to be thinking about today? Why is it so important? Stuart Simonson from the WHO, thank you for joining us. Over to you.
Thank you, Femi, and thank you for your kind introduction and for leading us through so many of these high-level UN events. Excellencies, colleagues, friends, WHO appreciates being included in today's event and welcomes the linking of eye health with climate action. This approach will amplify and provide additional support to WHO's work on climate change and health. Make no mistake, the climate crisis is a threat to human health and an obstacle to universal health coverage. For example, climate change can be relied upon to compound the burden of disease and exacerbate barriers to accessing health services, and at times when they are needed most. WHO estimates that between 2030 and 2050, climate change will cost approximately $250,000 additional deaths per year from malnutrition, malaria, diarrheal diseases, and heat stress. And this is almost certainly a conservative estimate. Climate change also threatens to significantly impact eye health. Trachoma, a neglected tropical disease and leading infectious cause of blindness, will likely be impacted due to changes in temperature, rainfall, and reduced access to clean water. These are key environmental factors in disease transmission. And there is a very real risk that severe allergic eye disease will occur more frequently due to the increase in air pollution brought about by fossil fuel-driven production and transportation practices. Similarly, exposure to indoor air pollutants caused by cooking and heating with biomass, kerosene, and coal can lead to severe eye problems. And food insecurity caused by unpredictable harvests threatens to increase vitamin A deficiency, a leading preventable cause of childhood blindness. Climate change will also disrupt eye health service delivery. Extreme weather events such as hurricanes, floods, wildfires across the world have already led to temporary closures or destruction of medical facilities and supply chains for critical medical products, including medications, surgical materials, glasses, and assistive devices. Disruption to critical eye health services will further exacerbate already strained health systems and eye care workforces. Areas with weak health infrastructure will be the least able to cope with without substantial assistance to prepare for and respond to these threats. Importantly, we should not underestimate the role the health sector plays, including the eye health sector, in taking climate action and achieving Sustainable Development Goal 12, responsible consumption and production. Globally, healthcare is a massive consumer of resources and source of greenhouse gas emissions. Ambassador Webson mentioned this at the outset. To achieve SDG 12, WHO encourages a shift towards sustainable procurement, which considers the entire life cycle of the supply chain. Here, emissions can be reduced by decreasing demand in goods and services, embedding environmentally responsible and sustainable services into the procurement process, and following the principles of circular economy. A key example in the field of eye care is cataract surgery, one of the most common surgical procedures worldwide. Global variation in procurement of consumables, consumption of energy for the procedure itself, and disposal of waste produced are all key areas that can be made more environmentally sustainable to reduce the carbon footprint of the eye care sector. The priority over the coming decade is in building climate resilient health systems and tracking national progress to protecting health from climate change. WHO believes in protecting populations from the impacts of climate change by enhancing the climate resilience of health systems against challenges brought about by deforestation, massive forest fires, sand and dust storms. These affect all our health detrimentally and impact safe vision for people everywhere. In closing, let me emphasize that climate change is not just an environmental issue. It is a health issue, and one that with very specific impacts on eye health. And we must not forget that the eye health sector has an important role to play to reduce emissions through responsible consumption and production. Events like today's are important in driving this agenda forward, and my colleagues and I at the WHO office at the UN are grateful for the work this group of friends is doing to draw attention to the link between climate change and eye health. Thank you. Back to you, Femi.
Thank you, Stuart. I'm just thinking about your keynote. I'm listening very carefully to it. What was the part where you put a highlighter pen through it and said, this is really important? Webinar audience, do not forget this part. What is it?
Well, I think it is that climate change is not just an environmental issue. It is a health issue. The world is a biologically dangerous enough place right now. I think COVID and Ebola and Nipah and Chagas influenza have taught us that. Nature is sending us a signal with these diseases and these health problems. And climate change will just exacerbate that and make the world so much more dangerous. COVID has taught us that we are not prepared.
Okay.
And so to but we know, as Ambassador Webson said at the outset, that
Stuart, your highlighter pen is running out of ink here. What was the takeaway? One line. Bring it to us.
I gave you a highlight. I said it is.
You did it. All right. Very good. I appreciate it. Thank you so much. Stuart Simonson, this is why he's the Assistant Director General for WHO. He is never at a loss for words. We thank you so much, Stuart, for being part of our webinar. And the list of health issues and crises that are out there. I'm surprised that he still has dark hair. Stuart Simonson, thank you so much for being part of our conversation today. We move on because we have other very important presentations that I want to bring to you. We start with Dr. Cassandra Thiel. She is the Assistant Professor of the Department of Ophthalmology at NYU Grossman School of Medicine, also co-founder of the IAPB Climate Action Working Group, and one of the greatest leaders in global eye health as well. Goodness me, I'm just going to hand it over to you, Dr. Thiel. You are you've got so many credits that I'm stumbling over all of them. But I do want to ask you, what do you want to share with us? I know it's a very important study and an overview that will help set us up for our panel discussion and many, many questions to come. Dr. Thiel, over to you.
Thank you so much, Femi, and thank you to everyone who spoke before me. This is a wonderful summary of all of the issues that we're facing. Today, I just wanted to share a little bit about one of the studies that I've done in the eye care space. And so to kind of get us started thinking about this, I'm an engineer, and one of the tools that I use to analyze the environmental footprint of things is called life cycle assessment. And what this tool basically is doing is looking at emissions from a product or process throughout the entire life cycle. So you can think of it as, raw material extraction, right? Everything that we use has to come from somewhere, whether it's wood-based products or coal and oil. And it gets transported around the world to factories where it's manufactured into products for eye care. This could be our spectacles, our glasses. It could be surgical supplies. There's so many things that are needed to provide healthcare services. Oops, I seem to have lost my sharing link here. If someone could advance the slides. Oh, I see it. It moved over here. Sorry. All right. And from producing the goods and services, right, we end up purchasing these items. We're using them. Sometimes that requires energy or it has other emissions. We will often reuse or recycle some components, but ultimately most human-made products end up being thrown away, and that can mean incineration. It can mean landfill. But basically, life cycle.
But
oh, sorry. Throughout this life cycle, we have emissions, of course. There's inputs coming in and there's outputs flowing out. And life cycle assessment takes all of those emissions across the entire life cycle and sums them into a single value, like a carbon footprint. So this is the main tool that I use when I'm working with healthcare services to try to identify where our emissions are coming from, so that when we want to enact changes, we can do things that will have the biggest impact. So I started working in this area because of a surgeon. When I was a graduate student, it was Dr. Noe Copley-Woods, who was an obstetrician, and she was upset about how much garbage she could make. But people kept telling her to just recycle more, and she felt like she needed more data to support that decision. And what we found was that recycling isn't that effective at reducing your footprint. You need to look upstream and reduce what you're bringing into surgeries. And after doing that work, I read this really wonderful study from Dan Morris based out of the UK, and it's looking at phacoemulsification, which is one of the more common approaches for cataract surgery, especially in more developed countries. And what Dan and his team found was that a single phacoemulsification was equivalent to an average British person living for a week, right? So it's a small surgery, but it's like a week's worth of activities. And most of their emissions were coming from the procurement of their supplies. So this is all that production of all their single-use supplies. Although you can see here too, there's quite a bit from energy use during the surgery. And this wasn't surprising to me given some of the earlier work that I had done in obstetrics and gynecology. So I started to ask, what does healthcare look like in a place where it's just done more efficiently? Right? We see in North America and in Europe, we're using a lot of supplies, but that can't be the case around the world. And that really is what took me to Aravind Eye Care System. I'm just going to briefly describe Aravind because you'll hear a lot more about them from Dr. Tulsi after me. But they have a very different setup because they're trying to provide care to very low income people. And those people can't afford the surgeries if you're charging the rates that we charge here in the United States, for example. And so the surgeries were really designed to be efficient, but also effective, right? There's no point in providing a surgery if it's not going to have good outcomes. And what was great about working with Aravind is that they have excellent outcomes and they're well documented. So I was able to go there and just look at their resource utilization, knowing that their surgeries were still very good. And so I had gone to Aravind a few years ago now at their Pondicherry location, and we looked at phacoemulsification and all of the resources that they use. Because they are designed for efficiency and are reusing so much, we found that their footprint was actually quite small per surgery, especially when you compared it, of course, to the UK's numbers. So it's about 5% of the emissions that the UK would have for the same surgery, and again with the same outcomes. So this really shows that there are different ways of providing high quality care, and some of them will have a far less burden on public health, and that's really what we're trying to achieve. So now we're trying to take these lessons from Aravind and expand them out to other areas, both within ophthalmology and actually in other medical fields as well. This is just a really nice visual that shows that difference, right? We're very visual as people. And so here you can see the difference between one cataract removal in the US, the garbage that's generated there. In my research, we found that can range anywhere from 2 to 10 kilograms of garbage. Whereas at Aravind, you can see this is the garbage generated from 93 cataract removals. And that was, I think, equivalent to about 250 grams of garbage per case. So some pretty impressive differences that we can really learn from. And that's where I'll leave it for now, but I look forward to answering some of your questions.
That is such a strong, powerful visual. Thank you, Dr. TL. We now have to go to Dr. Tulsi Avila. He's a founding member and executive director of the Lions Aravind Institute of Community Ophthalmology. And you will see the acronym LAICO, which is what that means. He's also director of operations for the Aravind Eye Care System, and also the co-founder of the IAPB Climate Action Working Group. Dr. Avila, please add on to what TL shared with us. Where do you want to take us next?
Thank you, Femi. Excellencies, colleagues, and friends. Thank you for this opportunity to share my views on eye health and climate action considerations at this August gathering of United Nations Friends of Vision. I'll be drawing my insights from Aravind Eye Care System in India. Aravind is a high volume provider with over 4.6 million outpatient visits and 500,000 surgeries annually. Hence, we consciously work towards minimizing the carbon footprint. The overarching approach to minimize patients' effort in getting care. Some of the key strategies we operationalized are ensuring that we don't lose patients between various stages of care. That is between screening and diagnosis, or between diagnosis and treatment and follow-up. We do this by making it effortless for the patient to choose to close the care loop. Completing care in a single visit and at appropriate level reduces the patient's effort and the resulting carbon footprint. We have been proactively sharing such effective practices with other eye hospitals and through a structured capacity building process. Low productivity is a form of waste and directly translates to increased carbon emissions per patient. That is what we focused on. In this example of 65 hospitals studied, we could increase the surgeries by 54% within 12 to 18 months with their existing infrastructure and human resources. Integral to this was enhancing quality and their financial viability, as they are all interconnected. Over the years, we have worked with 350 eye hospitals across 29 countries, adding with whatever resources they had, about close to 800 additional surgeries annually. At Aravind, we are evolving a model for ensuring environmental sustainability. On one hand, we see a lot of scope on the resource front, that is green buildings, renewable energy, technologies that reduce resources like EMR, procuring multi-use items and recycling. Equally, we see opportunities in reducing carbon emissions with the right processes, efficient service design, and lean clinical protocols have significant impact in reducing medical waste. Completing the care in a single visit, providing care closer to their homes, and providing in-campus housing for staff all go towards minimizing travel. Effective equipment maintenance extends the life of the equipment, thus extending the replacement cycle. All these measures tend to significantly reduce the carbon footprint and at the same time reduce the cost and efforts for the patients as well as the providers. Thus, this is a triple win, and we see this as a low-hanging fruit for reducing carbon emissions. Thank you.
Thank you, Dr. Avila. Thank you, Dr. TL, and Ambassador Webson. Come join us. Now we are going to be in a panel discussion. You've made it very clear during this webinar that the climate crisis has a connection to eye health. I think you've made that very clear between all of the presentations, the keynotes that we've had. I really want to go straight to what is often left at the end, which is, what are the solutions? How do we do better? How do we use eye health and improving eye health to get us to the SDGs, to get us to 2030? Ambassador, what are you thinking? Having heard so much of this webinar, what are your action items for us?
Hi, thank you. What are the action items? As I said, we clearly need to, and it was emphasized by Sandra, I think, the doctor. I think there are two levels. 65. One is at the higher level, where we have to, as leaders in the health sector, whether it's surgeons or it's health planners, understand and how we can make the health delivery mechanism less intrusive on our environment, and how we can use so that we are not as big an emitter as we are. 4% is for the health sector. And if we can reduce that would be one area. So when we are looking at surgery, when we are looking at the procurement of equipment from upstream, then at the second level, for me, I am a person who is on the ground. So I'm very keen to look at the impact on those areas of those diseases that I mentioned, and how we can change that, how we can change the impact. Vitamin A deficiency in children continues to bug us, continue to be a major problem. and therefore we have to find solutions within that would be more sustainable to address this question.
Okay.
So those are the two areas I would focus on: the higher level, how we could, in terms of planners and the equipment, and then in terms of how we deliver everything from cataract surgery to, and I think the Aravin, and just let me say one thing about Aravin. I think Aravin, and I have been in this business or around it for a long time, Aravin is a remarkable institution. And for them to also be a leader in taking on climate action in its high volume performance surgery, it's remarkable, and I want to congratulate them.
Dr. Tulsi, Dr. Cassie, when we often think about climate action and who's emitting the most carbon, I think we think about big industries. I don't think we often think about healthcare industries. Dr. Tulsi, do you want to start first of all? How did that occur to you that you could be making a difference in terms of sustainability, reducing a carbon footprint through the production and eye healthcare?
I think in our instance, I think the trigger was being truly patient-centric. And I think it's very interesting. I think that approach really reduces carbon footprint. Like, for example, a simple thing like someone comes for a pair of glasses, no? And so they make a trip, no? And a trip translates to carbon footprint, okay? And then if on that single trip, you're able to give him a prescription or her a prescription, and then also make sure that in the next 25, 30 minutes or less than an hour, you're also able to give them the prescription glasses. All of this can be done with the right organization. You know, so if you don't do that, that person would have to go around to find an optical shop, place an order, make 2 or 3 trips to go and get it. You know, so this is where we recognize that by reducing effort to the patient, that is becoming really patient-centric. No, you can significantly not only reduce the carbon footprint, and I think very interestingly, it also reduces our effort as well. No, so I think in everything that we do, we follow this sort of an approach. No, and that significantly has an impact on the carbon footprint.
Cassie, go ahead.
Yeah, I was say there. For me, when I think about various industries, healthcare is one of the drivers, basically the demand for other industries. So healthcare itself doesn't emit a whole lot. There's very few hospitals in the US, for example, that now have incinerators anymore, right? So that's a direct source of emissions. But anesthetic gases are greenhouse gases, and that's something that hospitals emit. But as a service industry, hospitals have, or healthcare facilities have a much smaller footprint than, you know, some of these product manufacturers. Yet to deliver healthcare, we need that heavy industry. And so really trying to change healthcare's footprint is really trying to drive these other industries into more sustainable practices. So if it's, you know, decarbonizing transportation as one example, you know, making sure your ambulances are not running off of petrol fuels might be one approach. And there you're trying to shift a different industry, but you're using your influence as a healthcare facility to do so. Likewise, all of the things that we're purchasing, which is a lot here in the US, the image behind me is all of our medical waste at our loading docks for probably a couple-hour period, right? We make so much garbage, but that means that we are buying things from industry, and we can talk to all these different companies about making better products, increasing circularity, for example. You know, how can we increase reuse? How can we safely participate in a circular economy? These are things that healthcare hasn't really thought a lot about, unfortunately. You know, we've focused so much on caring for the patient in front of us that we've forgotten that we have some ability to influence change broadly for public health. Yeah, so I'll leave it at that.
I'll jump back in and And just the two things that were mentioned that I think is critical, because I think in general, when we speak to public health officials and ministers and so forth, we do not really equate the damage of the environment or healthcare with the environmental damage. It's very seldom that we get into that. And I think making people know, making policymakers aware of while healthcare itself may not be a major emitter, but because of its relationship with industry, because of its relationship with government, where government purchased equipment, and this is in developing world in particular, that we need people to be able to make the association. The patient-centered thing, when discussed just now by the doctor about how patients come to a place, and then they have to go and find the glasses somewhere else and so on. We don't usually put those together, but beginning to get people's awareness that that is part of the process of measuring your footprint, those I think are critical. So that new public awareness is critical.
Let's go to some questions from our webinar audience. Thank you, audience, for putting the Q&A box to use. This one comes from Daniel. I love it because I said to you, panel, let's go straight to actionable items. Daniel came up with one, which is brilliant. All right, I think it's brilliant, but I'm not a doctor. So doctors, tell me, is this brilliant? How much of a reduction in air conditioning use is provided by performing surgeries at night and ending at sunrise? Tulsi, is that a brilliant idea, or am I just being seduced by that? Well, is it good?
It's an interesting thought. Certainly, it's not rocket science to recognize that temperatures do drop at night, and then so the cooling energy required is definitely low. But I would think it would very greatly inconvenience both the patients and the doctors. No, because our body clock doesn't work that way. So yeah, that's where I would.
Daniel, I'm sorry. I was hyping up your question, but no. Dr. Tulsi says
I think
no.
it also depends on where you're located in the world. Right? We're approaching our winter here in New York, and so daytime surgeries would be perfectly fine.
Okay, Daniel, I like the way you're thinking. Keep some more ideas coming through. All right.
What we can be thinking of, though, is driving a lot of our hospitals, and people in developing countries are beginning to do, including my own country, is driving the electricity in your hospitals by renewable energy.
Exactly, yeah.
This is a good question from Mesfin. All questions are good. Send them to me, all right? I'm going to be supporting your questions. The panel may not be, but I am. What mechanism does the WHO or the UN, so the ambassador, this is for you, have to ensure that all parties and stakeholders are committed for joint actions? This is interesting because we're talking about eye health and we're talking about climate action. They could be quite siloed. We're trying to really put the spotlight on why they are compatible. Ambassador Robson.
I'll let Simon take us, maybe respond to that with the WHO component, because there are mechanisms, of course, within the WHO system and within the General Assembly that that provides the opportunities for governments and so on to respond. So Simon, I wonder if you wanted to say something first.
Is Stuart still here? I see a little blocks with him.
Yeah, he's still connected. Yeah.
All right, Stuart, are you still connected? Are you there? Did you take your jacket off? Unmute yourself. If I see you, your video, it comes to life again. Do come on, and you can answer that in a moment. Let's move on. Dr. Tulsi, this one's for you. This is from Dr. Bat. Is SICS more environmentally friendly than PHACO, PHACO? Any thoughts?
Yes, the answer is yes. I think for those who don't understand this language of SICS and PHACO, it's a different surgical procedure which is done manually without the use of equipment. So the manual small incision cataract surgery, which is called as SICS, does use far less consumables and thus has far less wastage. So in the study that we did, because in the West, pretty much all surgeries are done. The default is phacoemulsification, which is the reason why we compared the phaco procedure in Aravind with that in UK or in the US. But within Aravind, I would guess 60% of the surgeries will be done through the manual small incision, resulting in even far lower carbon emissions and medical waste. Yeah.
Yeah, I concur.
Yeah.
I would say the same thing. We don't. I don't think we have any published data on it, unfortunately. But we know that the garbage is far less. We know that they're not using like the phacoemulsification comes with a phacoemulsifier that uses a lot more electricity and all of these things. So so logically, it makes sense that it is using far fewer resources. We don't know exactly how much, but that's one of the things that we've been talking about with the Center for Sustainable Healthcare and their connections in the UK, for example, is, you know, it would manual small incision be an approach for modifying footprints, or there's other things in like Arvind's approach to have multiple patients in an operating room is not necessarily something we can do in the US for a variety of legal reasons, but we may be able to, you know, have surgeons bouncing back and forth between two operating rooms. So we're trying to come up with different processes that might lead us to be more efficient with our resources.
Thank you, Reverend Audience. You're sending us some good questions. This is probably the reason why Dr. Bhatt says, I'm an Indian doctor, an alumni of Aravind. Dr. Jasri Bhatt here. Sorry for the abbreviations used. Thanks for the reply. We do need studies on this. You'll excuse the abbreviations. It's to be expected in not only a medical space, but a medical space and a UN space as well. How can we not have abbreviations? But we have the panel who will decipher them for you. I am fascinated by the idea of the climate crisis creating an eye health crisis too. How we draw that direct connection between eye health and the climate crisis. Ambassador, do you want to dig into that a little bit deeper for us? And I'll ask all of the panelists. Give us one example, one story.
I'll thank you. I'll go from the what is almost the obvious in terms of, I want to pick, we talked about some of the eye health child diseases that are created and exacerbated through a climate crisis. So vitamin A deficiency, naturally that's linked to agriculture, right? And as we deepen as in my part of the world and other parts of the world similar, where things are drier and you have less greeny leafy vegetables, etc., that helps to deepen the crisis. As we talk about trachoma and the diseases that are spread through trachoma infections, and again, in drought-prone areas, in areas where diseases are then spread more, those are part of the climate crisis that impacts upon eye health. As we talk about the challenges around age, and I am picking issues that directly affect an individual who is struggling, whether it's a girl or a woman or and children to whom I dedicate much of my life. We find these are the things that are exacerbating the eye health in terms of the climate crisis. Injuries and when disaster, the increased disaster that is created by the climate crisis, and children and women are left in far more vulnerable circumstances and situations. The doctors, I am sure, can identify other areas, but in terms of direct impact upon the individual, you know, these are some of the things that come to mind immediately.
See, I asked Dr. Tulsi and Dr. Cassie to bring me one brief story that really encapsulates the conversation that we're having today. Dr. Tulsi, what's your story?
So the storyline that we've been following in Aravind, especially to promote good practices around carbon footprint, is especially in the developing economies, where we have a resource crunch, is to really have them recognize that systematic approach to reducing carbon footprint can really come out of reducing the effort that both the patients and we put in. And fortunately, both of that translates into both top line and bottom line for institutions. So it's a very, very, I mean, to us, it's a very compelling argument because I think at the core of reducing carbon footprint is reducing your resource consumption. The point that Cassie made repeatedly. Upstream, you reduce how much you consume, which means you adopt very lean practices, you adopt very lean processes, you try and eliminate waste as much as possible. So all of this, I think, adds up to less carbon emission, and I think much more financially viable organization. So we're using that as the storyline for really promoting this. Yeah.
And I think to add to that as well, when you do end up reducing and developing more reusables, you actually develop more resilience as well. During the COVID pandemic here in New York, in March 2020, we saw massive shortages of PPE, personal protective equipment. And it's because we use single-use disposable everything. If we had reusable gowns like Aravind has, then we would own our gowns and they would be here. We may need more of them, given what happened with COVID, that we just needed more protection. But we would at least have some base load that we could pull from. So when supply disruptions happen from climate events, as they have happened in the past and are very likely to happen in the future, if you have your own stock of reusable supplies, you're not only reducing your footprint, but you're also increasing your resilience to those changes.
I'm going to bring in Stuart Simonson from the WHO. Stuart, this is a question for the ages. It almost applies to every issue the UN and the WHO is trying to get to. Let me just remind you, it came from Mesfin. What mechanism does the WHO or the UN have to ensure that all parties and stakeholders are committed to joint action? How do you do that? Stuart, unmute yourself so we can hear the gems and the magic coming from you. Go ahead.
I will say this in just a few words.
Yeah.
We convene experts, we study problems, we shine a light on the issues, trachoma, the problems with ultraviolet light and the burden of disease. We shine a light on that, and we bring parties together. That is how we drive consensus.
And we can add the fact, this resolution that we have passed, that Ambassador Rabba made mention of, and Ambassador Geraldine made mention of. Well, this things like that commits governments to taking action, and that we can work with the civil society community to follow up those actions and those commitments that governments have made by supporting and passing such resolutions.
If I could just add, I think this group of friends is an example of how we do it too. And I can't overstate that. The work of this group of friends to bring people together and to talk about issues like the linkage between climate change and health. That is a really important contribution, and it makes a difference.
Cassie and Dr. Tulsi, thank you, Stuart, and thank you for being available for the Q&A. Really appreciate you. What I see from this is that action is happening not necessarily on the political level, but on an individual and business level, on a health level that is so important that we don't always know about. What is the last thought, Dr. Tulsi, you would like to leave our webinar with?
Really, to pick on what you just now said, Femi. So right now, we are a non-profit, a non-government organization. So we are doing what we can within our remit or our own capabilities. But I think we'll be a lot more effective, if at the government level also there are much more enabling kind of policies, and like for example, we would like all our hospitals, the big and small, to switch to renewable energy. But then today the government policies really don't encourage or enable that. So that's one line. And the second one, I think when it comes to forming rules, regulations, there is a tendency to sort of sometimes very blindly copy what is happening in the West, where the context is very different. And what happens out of that is the regulations sort of push you to use more consumables. Like say in India, we do have a quality body which is coming up now, which is now pushing for a single operating table in an operating room, which would reduce our throughput by 50%. Which would really mean that we would need twice the resources to do what we are doing now. And all of that, none of it would actually increase outcomes or quality. So I think there is this dialogue that now needs to happen at granular level with the policymakers and the government to give us more power in our hands.
Mm-hmm. Dr. Cassie.
Yeah, I think those are excellent points. I would say for individuals listening in that your ground level activities are very important, but where we really need change is also at more of the systems level. And so using your influence wherever you can to help change businesses so that they can provide better products, to help governments incentivize more sustainable activities. Those are the things that really need to happen. So, talk to your representatives, try to move the needle on these things at whatever level you can, even if it's just, your department, your peers, that's fine. But do try to implement these systems changes, because a lot of stuff needs to change very quickly for us to get through this climate crisis.
Dr. Thiel, Dr. Avila, thank you for being excellent members of the panel. Ambassador Webson, you are not allowed to give your final thought yet, because we're not at that point yet. Literally hold that thought, because we are going to go to a call to action. That comes from Ian Wishart, the CEO of the Fred Hollows Foundation. He is going to bring us our call to action. He joins us via video.
It's great to be with you by video today. Decades of progress in reducing the burden of avoidable blindness and vision impairment across the world are under threat from the devastating impacts of climate change. We know climate change has a role in increasing the incidence of trachoma infections, cataract, severe allergic eye diseases and eye injuries, as well as vitamin A deficiency. We also know that as extreme weather events plague our communities, eye health services will be increasingly disrupted. These impacts will be disproportionately felt by communities that are already poor, marginalised, and least equipped to adapt to natural disasters or other environmental changes. In our Pacific neighbourhood, where the Fred Hollows Foundation, through our New Zealand office, supports eye health programs, the Intergovernmental Panel on Climate Change has warned small island states are already seeing serious negative effects on socioeconomic conditions, on local resources and on health. Similarly, in Australia, where the Foundation supports programs for Aboriginal and Torres Strait Islander peoples, the impacts of climate change may force communities off their land and disrupt essential health services. This will further strain access to eye care when Indigenous Australians are already 3 times more likely to be blind than other Australians. Health systems themselves are major contributors to CO2 emissions, and eye health is a part of that. Services contribute to greenhouse gas emissions, overconsumption of resources, and production of healthcare waste. Waste from common treatments like cataract surgery are of particular concern. Despite the challenges, with a willingness to do things differently and to work together towards innovative solutions, change is in reach. A great example is the Regional Eye Centre in the Solomon Islands, which has adopted a sustainable approach to eye care in partnership with the Solomon Islands and New Zealand governments and our sister organisation, Fred Hollows New Zealand. The centre was designed to be sustainable as well as disaster and climate resilient. Solar energy delivers 94% of the building's power, and it was constructed using durable, replenishable New Zealand pine. The centre can open year-round in all climates, regardless of the public power supply. And as I speak to you from the traditional lands of the Wurundjeri people of the Kulin Nation here in Naarm, or what you might know as Melbourne, Australia, I'm reminded we have much to learn from our First Nations custodians who have lived in harmony with the land, air and water for tens of thousands of years. First Nations knowledge must be at the front of climate responses. We are responsible to the environment which takes care of us. It requires greater humility, connection, choice and action from all of us. So today I call on governments, sector colleagues and friends to increase efforts to reduce the environmental impact of eye health on energy consumption and on emissions, on procurement practices and in waste management. We must partner with and learn from others, support research and generate evidence on best practice sustainable eye care. And we must be open and transparent, reporting publicly on progress, holding ourselves to account. Leadership is the key. We can do better, we must do better, and everyone must play their part. I leave you with that challenge.
Thank you, Ian. Challenge accepted. And finally, we go to Ambassador Webson for his final thoughts before I let you go about your day, Ambassador.
Thank you. And thank you again to all of the colleagues who have made a contribution, all of the doctors and the partners who have made a contribution to this really important event. Changing eye health care needs all countries will experience health impacts with climate change. Those of us with or at higher risks of visual impairment and disabilities will be proportionately more disadvantaged and suffer more. Consumption and production and eye health care, SDG 12 calls upon the eye sector to mitigate its carbon footprint, reduce its environmental impact, and support climate resilience. The effects of climate change, my friends, as we have heard today, on eye health vary from region and from season to season, but they are harshest on those already living in marginalized conditions, particularly women and girls and children. I think the message that we leave here this morning with is that we need to think of inclusive services so that we can understand and link and not work in silos. It's eye health, climate change is not just an environmental issue, it's a health issue, it's an eye health issue. And I again want to thank all of you for the contributions, for the questions, and for the discussion. The Friends of Vision, my colleagues, ambassadors, Rabat and Geraldine, we all deeply appreciate your full engagement in this. And we look forward to continuing to build awareness and advocacy. Our friends at IAPB and Phoebe, you particularly, for your continued enthusiastic leadership in chairing any of these sessions whenever we have them. Thank you. Thank you all. Have a great day.
This UN Friends of Vision Group webinar was brought to you by the team at the IAPB. Thank you, team, for all of the work that you have done, all of the work that you do. And thank you, attendees, for giving us somebody to talk to today. We appreciate your time. Take care.